Hi, this is Dr. Paul Broman with Broman Chiropractic and Wellness, and today we're going to talk a little bit about dry needling. So dry needling is basically the insertion of needles. They're the same needles as acupuncture needles along muscle pathways kind of directed at trigger points, muscle tension, and myofascial planes, the area between the skin, the muscle. There's fascia that can cause friction, create tension and irritation on those areas. So a lot of times patients have questions about the difference between acupuncture and dry needling because you're using the same needles and what the difference is. And really the most simple way I could explain it is that dry needling is directed at the trigger points of the muscle and more of the anatomy, and we can kind of feel and see to diagnose where we need to needle the pain points and the areas of tension. Whereas acupuncture is more focused, it's more of a Eastern medicine philosophy where it's looking at meridians and chi and energy flow, and they might be using the same needles, they might be needling similar areas, but the philosophy behind why you needle, where you needle is very different. So for dry needling, for instance, when we're looking at trigger points and where to needle, a lot of it involves the provider who's doing the dry needling locating where are the tension points, where are the trigger points, and usually those points will be tender to the touch. And people have questions about, is dry needling painful? And honestly, usually touching the trigger points just with your finger and applying that pressure, the pain you feel with that is usually the most severe pain you'll feel. Sometimes it will be a little uncomfortable when the needle's inserted because you'll have that muscle twitch, which is part of like the twitch response that allows that muscle to relax. But it feels nothing more than usually like a little bit of a pinch. Although dry needling is focused on more of the muscular network, it does help with what are called articular dysfunctions. So when you look at a muscle group, if the muscle is tense, the muscle also has an origin and insertion, meaning it has a bone that it starts and it starts off of, and then one that it expands to and inserts into. So every muscle has a joint that it affects. So releasing the tension in the muscle with dry needling can have a lot of improvement or a lot of positive impact on the neighboring joints if you have a joint or articular dysfunction going on. So conditions that we usually treat with dry needling, they involve chronic tension, stress, overuse, usually to muscle groups that are really hard to release and access on your own. So that'll create sometimes difficulty because you can't stretch, or even like if a massage therapist can't properly get to an area because it's hidden behind other deep muscle groups or bony landmarks. Dry needling can be really effective at penetrating and getting some really deep response from the muscle tension. So a few examples of these conditions: just chronic neck or back pain associated with muscle tension, headaches, tension headaches especially, usually attributed to tension through the neck or the TMJ, respond really well to dry needling. Tendinitis, plantar fasciitis, really things of that nature. When dry needling is performed, there are really three things that happen. The first thing is you're going to reduce the muscle tension, and that's performed because when the needle's inserted, it actually stimulates a twitch response into that muscle fiber, allows that muscle to relax and elongate. The second thing that happens is it increases blood supply to that deep muscle group. There's something that happens when the needle's inserted where it stimulates what's called a cytokinin response. It's a chemical that stimulates healing. One of the processes that happens when that chemical is released is it dilates the local blood vessels, allows for greater circulation to some of those deep muscle layers to help for more healing. The other thing that the cytokinin response allows is it actually has a downregulation in the pain receptors. So you will notice an immediate kind of reduction of pain usually. And that's part of the process that the needle insertion stimulates. The needle insertion does also interrupt the feedback loop with the nervous system that's associated with the pain response, where there's that brain to body, body to brain feedback loop. And the insertion of the needle will disrupt that feedback loop and help to mitigate some of the pain symptoms. Overall, when you look at the effectiveness of dry needling and how it can have such a great impact on a wide variety of patients, it's a really effective therapy that we perform a lot at our clinic just because it has great benefit to a wide variety of people. Thanks for watching. Hopefully this was helpful. And again, this is Dr. Paul Broman with Broman Chiropractic.